everyone, and thank you for joining the Equal Hope segment on CAN TV. My name is Leilani Lacson-Soltysiak, and I'm the Data and Communications Coordinator there. For those of you who are not familiar with Equal Hope, we are a nonprofit organization in Chicago whose mission is to help eliminate health disparities in Illinois. So we do this by offering free mammograms, free cervical cancer screenings, provide assistance with getting different types of vaccinations. For example, if you need to get your flu shot, it's not too late to get it. We can help you with that. And we also pair people for free with a primary care provider. So if you don't have a regular doctor that you go to, if you're not feeling well, we can help you with that. You can visit us at equalhope.org or give us a call at 312-942-3368 to learn more about us and to schedule appointments. Just wanted to announce that you can find us on Facebook, Twitter, Instagram, and TikTok. If you're a cancer patient, caregiver, or provider, we have cancer support resources on equalhope.org, and we just added some COVID-19 handouts on our website. Check them all out today on equalhope.org. So let me introduce this month's guests, Dr. Veronica Johnson and Jasmine Johnson. Dr. Johnson is an assistant professor in the Department of Medicine at Northwestern University, Feinberg School of Medicine, and she was also on our radio show a few months back. Jasmine is a clinical dietitian at the Center for Lifestyle Medicine and Bariatric Surgery at Northwestern Medicine. Dr. Johnson and Jasmine, thank you for joining us during National Nutrition Month.
Thank you for having us. Yeah, we're happy to be here.
Great. National Nutrition Month is this month. It is an annual campaign created 50 years ago in 1973 by the Academy of Nutrition and Dietetics. During the month of March, everyone is invited to learn about making informed food choices and developing healthful eating and physical activity habits. This year's theme is Fuel for the Future. Eating with sustainability in mind is a tasty way to nourish ourselves during every phase of life and to protect the environment. So let's get started. Dr. Johnson and Jasmine, tell us about yourselves and how you got into your fields.
Sure. So I am an obesity medicine specialist. And what that means is I basically help patients manage their weight. And I talk to patients about their lifestyle, but also utilize other tools to get them to a healthier weight, whether that be using medications or counseling them both before and after surgery. And the main reason why I got into this field was I found that as a Black woman, obesity and overweight are disproportionately affecting our population, and that was the one thing that I could do to kind of help eliminate that disparity as a Black woman. I think we all know that we do better when we're under the care of someone who looks like us. Mm-hmm. And so as a Black woman, I can help eliminate that disparity by taking care of more patients who look like me.
Great.
And then my name is Jasmine Johnson. I'm originally from St. Louis, Missouri. Right now, I'm currently working in the bariatric surgery department. So similar to Dr. Johnson, I help with more of the diet aspect of things. So looking at lifestyle, diet, exercise, looking at, people's calories, their protein, their fat intake, talking about beverages. And then, of course, if someone wants weight loss medications, then I refer them to Dr. Johnson, one of the other medical providers or doctors who can prescribe that. And then similar to her, I got into nutrition because one, I wanted to learn how to be healthy. And then two, similar to her, you don't really see that many Black dietitians out in the world. And I wanted to kind of help people who look like me learn how to eat healthier because a lot of our food isn't always the healthiest. So just trying to figure out different ways to help make our food healthier and help our people that look like us be able to have access to those resources.
Great. So some people use the words diet and nutrition interchangeably. What are the similarities and differences? Or first, can you define what diet and nutrition are?
Yeah. So I would say that your diet would be your long-term eating pattern. So that can be basically if you are someone who eats a normal healthy diet, or someone who eats fast food, or someone who is a vegetarian or a vegan, or someone who has to limit certain foods because of like celiac disease or different medical condition. That would be your diet, your eating pattern. Your nutrition would be the process of making sure that your body is healthy by feeding it nutrients. So the way I see that they're similar is that nutrition kind of makes up your diet, and then your diet helps you nourish your body or helps you to be healthy.
Great. So why are diet and nutrition important for people to know about?
Yeah, so I mean, diet and nutrition is come with the basis of, why we want to stay healthy. I mean, there are a lot of medical conditions that could be controlled with diet and nutrition changes, things like diabetes, high blood pressure, high cholesterol. And so that's why it's important, is because we can help treat these things and prevent these conditions if we're adhering to a healthy diet or nutrition plan.
So what exactly is a healthy diet?
So we brought a prop for you.
Oh, yay.
Sorry, Veronica.
Oh, my plate.
My plate. Yeah, a lot of people have seen that this would be what would be considered a healthy diet. So having half your plate fruits and vegetables, a fourth your plate protein, a fourth your plate your grains, and then having some dairy on the side, as long as you don't have any intolerances or any issues with any of these food groups. But also making sure you are drinking 0-calorie or low-calorie beverages like water versus having like soda or juice or sweet tea, sweet lemonade, making sure all of your foods are going to be low in salt, low in fat, low in sugar, and then of course cooking them in a healthy way. And following these things as long as you have no aversions to any of these foods, because some people have to limit their fruit or their grains if they are someone with diabetes. So keeping that in mind.
Okay. So what is the currently recommended calorie intake per day for, let's say, the average adult, not someone who has chronic health issues?
So I do like that you said that caveat. I'll give you the general guidelines. I actually had to look this up because usually I kind of look at, the patient's age, their height, their weight, their medical condition, if they want to gain weight or lose weight. But based off of the current dietary guidelines for Americans, for men, it could be between 2,000 through 3,000 calories a day for adult men. And this is not counting sort of if they want to lose weight, gain weight, etc. And then for women, adult women, should be about 1,600 through 2,400 calories per day.
Okay. So what percentage of people actually follow these guidelines?
I mean, I think it's really hard to put an exact number on that, just because, there's a lot of variations as far as what Jasmine was saying. Different people have different specific calorie goals. So I think that's a really difficult question. I think one thing to note is that, on the food labels, that's all based off of the traditional American diet of about 2,000 calories per day. And so when you see like percentages of your daily allowed value, that's based off getting 2,000 calories a day. So I guess that would be ideal, or the average is just trying to get at least 2,000 or no more than 2,000 calories per day. But again, it's hard to say what that specific percentage of Americans who get that.
Okay. So one follow-up question I had was about the food pyramid. Is that still relevant? Because I mean, a lot of people remember when they were growing up and going to school and seeing the food pyramid.
Yeah, so actually the My Plate replaced the food pyramid. I grew up with the food pyramid as well. And I guess people realize we don't eat based off of a pyramid, so they switched it to the My Plate because we eat off of a plate. But yeah, I guess the My Plate is the new My Pyramid.
It's the modern pyramid now.
Yes.
So in simple terms, some fast facts, why should people follow a healthy diet?
So definitely to be healthy for yourself, for your loved ones, to reduce, any chronic disease risk, or to decrease the complications for chronic disease, and then also to be able to feel better, to be able to move more. People who have, diabetes or have excess weight. Sometimes they can't move as well. They may not be able to play games with their children or just do simple activities. So like tying up your shoe. So just to be able to overall feel healthy, feel good, and be there for your loved ones.
So why do some people find it difficult to follow a healthy diet?
I think, our lifestyles are very, very busy, and sometimes it's hard to find the time to prepare the foods that are healthy. And so as a result, we are really quick on the go and get a lot of the foods that are more convenient. And those foods, as a result, are just not as healthy for us. They're either fried or they're loaded with high fats or added sugar. So that makes it a little bit more difficult. And then also just the cost of sometimes eating healthy can be tied to excess expenses. And so if we want to cut down on the cost of things, we'll grab those things that are cheaper, which are typically more processed and likely more unhealthy. So,
and for people who aren't familiar with processed, what are processed foods and some examples?
So one thing to know is that not all processed foods are bad for you per se, but I look at processed foods like foods kind of like cookies, cakes, candies that are basically have like really no nutrient value. Like they take everything out of it to that has some of nutrient value to make it taste good and appeal to like the addictive properties of foods. And I wonder, I don't know if Jasmine has anything else to add to that comment, but that's what I usually think of as ultra processed foods is the big thing. I think all foods that we have some kind of process involved with it, but it's really looking at those things that really have eliminated all those nutrient values and just are not healthy. They don't do anything to our body as far as health.
Yeah. And it's like those foods that Veronica or Dr. Johnson was saying that are higher in calories, but don't have a lot of vitamins. They don't have a lot of minerals. They don't have, some of the good proteins, some good fats, some healthy carbohydrates that we need versus something that, like for example, I'm thinking of kale. We're going to talk about kale or spinach, for the same amount of calories and maybe like a bunch of kale compared to like a bag of chips, you're going to have some calcium, you're going to have vitamin K, you're going to have, some water in it versus the chips may have high salt. It's going to have some sugar in it because potato chips are a carb. So kind of weighing your options. Do I want something that maybe same calories, but it's going to give me more nutrients that my body needs, or something that's high in calories that's going to give me a lot of salt, a lot of sugar, a lot of fat that I may not need. Hope that makes sense.
Okay. So TV dinners and, ready to heat, ready to fry meals would be included as processed?
Yes, but I would say there are some healthy TV dinners nowadays, like Lean Cuisine. There's the Annie's one, and then a lot of times there are sometimes healthier versions of food. So processed foods or foods that will say like no salt added or reduced fat, but there are some that are unhealthy, like some of the regular TV dinners that like include the mac and cheese and the brownie and the fried chicken, and maybe a little bit less healthy compared to something that may have grilled chicken and maybe a fruit cup. And I'm really thinking of greens right now, so maybe greens for the side. Hope that, yeah.
Oh, interesting. I didn't know that Lean Cuisine was considered the healthy type of TV dinner. Oh, that's good to know.
I think one thing to note with some of those more prepared meals is that the sodium intake can be really high in that. So that's one of the more important things to look at on the labels is like trying to see what the sodium intake or content is. Because we should get no more than like 2,000 milligrams of sodium a day, and sometimes less depending on, if you have like high blood pressure or heart disease or something like that. So they're not out of the picture. It's just making them work within your dietary, your diet and what your doctor recommends.
Okay. So another follow-up question I have is, Jasmine, you'd mentioned, I think like fat-free or low in sodium. So when people see things like fat-free, low in sodium, dairy-free, sugar-free, are they bad for you necessarily? Because sometimes I'll see, on social media or like read things online that say, if you see these things, that means there are chemicals in them.
So I would say yes and no. So if you're looking at it, something that says, salt-free, reduced sodium, then you know that they are preparing it without the salts. I would say that's going to be healthy.
Mm-hmm.
Some things I'll be concerned about would be foods that, they are fat-free, but then they're replacing it with something else, or if they are sugar-free, but they're replacing it with something else that could be harmful for you. And then also, a lot of people aren't aware of this. There can be, and I forget the amount, but there can be still a certain amount of fat, a certain amount of sugar, even though the label does say fat-free, sugar-free. It's just a small enough amount that the FDA deems it as negligible. I can't talk today, but it's not that high amount. But it's more just if they are removing it and replacing it with some chemicals that we do not deem as safe. So some things like some of those sugar or the sweeteners, some of those are still deemed safe, but there are some out there that people are worried about. But things like stevia equal, you can always have it. It's just more, sometimes it's concerning if people replace the sugar, but then they add extra fat, or if they get rid of the sugar or get rid of the fat and then they add extra sugar.
Okay. So let's do some diet and nutrition myth debunking. First one, cut out grains like pasta, bread, and rice if you want to lose weight.
I would say you can do that. You will lose weight, but if they are whole grains, so whole wheat pasta, brown rice, wheat bread, those are still healthy. I would rather you eat those versus cutting them out and replacing it with something that could be a little bit more harmful for you. So if you want to follow that type of diet, you can, but I would say maybe limit it versus cut it completely out.
And personally, in my experience, like eating grains before a workout really helps fuel my body compared to other things. I've always gone for whole grains. So
definitely.
Whole grains have high fiber intake in them, so they make you feel full for longer as well. So it's not something I would completely eliminate, it's just making better choices.
Avoid all fats if you want to lose weight or be healthy.
I will definitely say no to this. So a lot of times in general, if something says avoid everything, that's probably a no. There are still healthy fats. So like oils, canola oil, vegetable oil, olive oil, those are still healthy for us. We just want you to avoid or limit those fats that are solid at room temperature. So like your butter, like margarine, those are going to be the ones that will increase your heart disease risk, your stroke risk if you're eating too much of those. But all of our oils are great. Avocado is still considered a healthy fat. So I don't want you to avoid those. It's just limiting those unhealthy fats.
Okay, and that's good to know. I like to eat like half an avocado because I think eating a full avocado isn't good for you in one day. Dairy is bad for you.
Dairy is not bad for you, as we showed in my plate. I mean, it is a part of the nutrition that you should be getting into your body on a daily basis. It has calcium, it has vitamin D, so it has all those added nutrients that your body really needs to fuel itself and run and function like it should. So it's not something that I would completely remove. And sometimes people feel like, well, I'm just taking calcium supplement or I'm taking vitamin supplements, but I feel like the best way to get the nutrients that you need is from the whole foods.
And then also dairy does have protein in it too. So like there's protein in milk and cheese and yogurt. And I get sometimes people aren't fans of those, but then you can always, if you have a milk allergy or if you're lactose intolerant, you prefer switching over to like soy milk or almond milk or oat milk. If you're looking for that high protein, soy milk will have the highest amount of protein in it. The oat milk and the almond milk don't have as much, but just make sure when you do choose those alternatives, if you're 100% off dairy, make sure you get the unsweetened kind, because I don't want you to replace the cow's milk that does have those great nutrients that Dr. Johnson said, and then replace it with, sweetened almond milk, because then that's basically turning it into a sugary beverage. So be careful with that.
Okay. And I was going to ask too, speaking of dairy and calcium, so calcium pills shouldn't replace the actual, milk from a cow then?
I would say just preferably it's best to get those. I mean, the calcium, and everyone has different needs. But it's always best to get the nutrients that you need through the food that you eat, as opposed to taking multiple amounts of supplements.
Yep.
And then the last one, a detox diet will rid your body of toxins. This is for all the juicers out there.
I know. So this one, I get this question all the time. So our liver and our kidneys do actually do that for us, as long as they are healthy. There's really not a way to jumpstart or restart your body. Basically just trying to follow a healthy diet. So some of the things we talked about earlier would be the best way to do it. I do know a lot of people who do go on juice fasts to cleanse themselves. You may do it, but then if you're going back to eating the unhealthy habits, it's kind of pointless in a way. So I think basically just trying to follow a healthy diet long term is 100 times better than just doing juice fasts a few times a year or trying to restart or rejump your body system.
So what do you both think about these types of diets out there, these fad diets? For example, some of them include paleo diet, keto diet, which I think is pretty big right now, and also intermittent fasting, which to me is just like skipping breakfast. Do you recommend any of these?
So I will say for all diets, well, not all, a good amount of diets, there are some things you can take away from them. I would just say some things to watch out for. So like the keto diet, you are replacing a majority or good amount of your carbohydrates. And for someone who is like someone with diabetes, who is on diabetic medications, following a really low carbohydrate diet can be dangerous. You can have a low blood sugar. So just be careful with that. I'm not a fan of if you're going to cut out that fruit and those wonderful whole grains and replace it with butter, which a lot of people do on the keto diet. That's not going to be healthy long term. And also, if you are following this keto diet or intermittent fasting or paleo diet, or etc., and you can't maintain it long term, then it's kind of pointless, because you'll do well, lose all of this weight, and then you stop because you're like, oh, I reached my weight loss goals. And then once you stop, if you start going back to your previous habits, then it's not helpful. So it could just be taking little things. So lowering your carbohydrates from, the keto diet, from the paleo diet, maybe limiting some of those ultra processed foods and eating some more of foods that are like fruits and vegetables and some healthy lean protein, and taking that away from it. And then from the intermittent fasting, that's a diet that kind of depends. Sometimes people will fast for 8 hours or a day and maybe eat for a long time period, or vice versa. So if you're someone who tends to eat during the nighttime all the time, maybe having that window after 8 p.m., I'm not going to eat anything, may be helpful for you, versus if you're going to say, I'm only going to eat for 2 hours a day, that's when it gets kind of dangerous. So maybe taking the good aspects of it of, oh, I struggle with eating really early in the morning or eating really late at night, and cutting my window off. So then that way I am doing some aspects of intermittent fasting, but not doing the ones that could be potentially harmful.
Well, that's a good way of framing it. So speaking of sugars, I've witnessed people get into arguments over this. Some people won't eat fruits because of sugar. What do you think about that?
So yeah, so fruit does have natural sugar in it, fructose, which is not high fructose corn syrup, but just fructose. I think there are certain populations of people who cannot eat fruit that may have issues with it, but the general population, fruit has that wonderful fiber that Dr. Johnson was talking about. It has a lot of great vitamins and minerals. If you are someone who struggles with diabetes, you can have fruit, just may need to limit it. So versus having an entire banana, maybe have half. Instead of having, a whole bowl of fruit, maybe you just have a half of a cup. So I would never tell anyone to not eat fruit unless medical wise you can't have it due to an intolerance or an allergy. But yeah, fruit is healthy for you. But yeah, people do think that they can't have it.
And I think one thing also to mention is that people feel like eating whole fruits is the same as drinking the juice. And one of the things that happens when you juice fruit is you're taking all the wonderful like nutrients and fibers out of it, and you're just basically drinking sugar. So, you know, while some people are like, oh, I'm juicing, I would much rather you eat what you're juicing, and probably you'd feel a lot more full, considering how much you have to juice to get what you got, as opposed to eating the actual fruit. So that's one thing that I always try to talk to my patients about too, is just the thought about juicing and be cautious about juicing.
Okay. Well, I'd like to thank you both, Dr. Johnson and Jasmine, for being guests on the Equal Hope segment on CAN TV. Join us next time on April 25th from 5 to 5:25 p.m. where we'll talk about diabetes. Thank you everyone for watching. Good night.
Bye, take care.
Bye, thank you.
Bye.